2-year-old Jimena Corona doesn't know what's happening to her because she's under anesthesia. But with every zap of a laser, Dr. Paul Friedman is removing a rare and potentially life-altering birthmark called a nevus of Oda that once covered her face.
As a parent, you just want your child to have the best, and you don't want to suffer.
Friedman has been treating the toddler since she was just a year old, using 2 different lasers. This is her 11th treatment.
The results are great. We're very happy. My child is improving. She has improved like 50% or so. We've seen a lot. Even our family has noticed.
The Coronas just moved to Houston, but for the previous 10 appointments, they were traveling all the way from Mexico City so that Jimena will eventually enjoy a completely normal appearance.
This has a solution. That's what's making us happy.
1.5-year-old Elijah is clearly not happy about his treatment. Since he isn't sedated, it's scary. He was born with a birthmark called a port wine stain.
It was real dark around his lip up to his eye.
Port wine stains affect 0.3 to 0.5% of all infants, but Dr. Friedman says he sees several patients a month who travel from far away to have them removed.
We utilize the pulse dye laser for the vascular birthmarks, which is a laser that's designed specifically to treat the port wine stain. The technology has gotten better so that the safety margin is much better.
We started treatments when he was, I believe, 3 weeks old, and it's lightened it. It's lightened it a lot.
Elijah's family comes to Houston from Louisiana, requiring an overnight stay each time. It will take dozens of treatments, but the results have been dramatic and will spare him the burden of having to look different from other children.
He won't even know this ever happened.
Studies show that the best results come when you start treating a patient before the age of 1. That's a tough decision for parents as it can take several treatments, but with time, these birthmarks become much more difficult to treat.
It's not uncommon for us to start as young as 2 or 3 weeks of age. We can achieve better results when the skin is thinner and the birthmark is not as deep.
When I was young, there was nothing really available at that time.
Mary Tharp has had 14 treatments on her port wine stain.
As I was younger, it was just flat, and of course it was the red port wine stain. But as I aged, there were areas that would get raised.
The same laser used on Jimena will significantly reduce her birthmark, but because of the years that have passed, it will never be totally gone. Mary says the improvement has been well worth the 2 hours she drives just to see Dr. Friedman.
I've been very pleased. People that haven't seen me for a long time are just amazed because they'll think it's completely gone, and it's certainly not, but it's, like 80% compared to what it was.
She's also happy that children can now start this process when they're born and not have to struggle with the sometimes cruel treatment that can happen when you look different.
It's amazing.
Katie McCall, Fox 26 News.